Okay, so we just have a few NTAC housekeeping slides. For those of you who've been here, this will be very familiar. For those of you who might be new, this is just a disclaimer that NTAC is funded by SAMHSA. And this is a brief overview of what NTAC is. We have a multidisciplinary team that works under the NTAC umbrella. So we have all these different amazing partners across the United States who collaborate with one another to make sure that we have really great training and TA that we're able to offer. And so our goal is that all children, youth, young adults, and families have access to evidence-based treatment and recovery services in a well-coordinated system of care. So we are part of the infant and early childhood team for NTAC. So we're really focusing on those younger years. There's many other teams. So we have an aging out team. We have teams based in school clinical spaces. We have family. We have youth voice and choice represented. So there's lots of different systems that are representative throughout our NTAC program. And these are some of the people who we serve. So like yourselves, we have a lot of mental health people who hop on to different trainings in TA. We do primary care providers, school workforce, community-based providers, peer supports, family partners, youth partners. And then these are just some of the services that NTAC is able to provide at no cost. We actually have some open houses coming up at the end of the month if you're interested in learning more about what's going to be provided in year 2 in terms of training and technical assistance. But we have the 5 Things Digest, which you can subscribe to through the website, and that has different resources that pop up every month. We have individual consultations, we have communities of practice, we have podcasts, there's trainings and other practical tools. And we're so thrilled to have Amy Hunter with us today. Amy is an assistant professor at Georgetown University, and she has some really great work to share with us. So Amy, I'll let you sort of introduce yourself a little bit and take over here.
Thanks so much, Julia. It's a pleasure to be here. I'm looking at this picture. I'm like, I had short hair and I was a lot younger, but okay. It's really nice to join you all. I, as Julia said, am an assistant professor with the Georgetown Center for what are we? Child and Human Development, right? And I work on a number of projects related to Head Start and the pyramid model, if you're familiar with that, but mainly anything related to infant early childhood mental health and mental health consultation. So I'm happy to be with you today. So you can go to the next slide. Thanks, Julia. So what I thought about today when Julia and I talked about this is sharing some of the work that we have done in the last few years related to the opioid crisis and substance abuse prevention and recovery in Head Start. So a few years ago, that was a strong federal priority, and Head Start actually received money to do quite a bit of work in that area. And so I wanted to share with you some of the things that I learned going into this work and a little bit of my own process of thinking about addressing substance use and addiction in early care and education. And I'm going to hopefully share with you some of the resources that we found along the way. When you hear those 2 words together, addiction and early care and education, what comes to mind? It's good for the child to be in Head Start program because the parent may not be involved at home. Oh, wonderful care. Challenging relationships, separation, challenges with judgment, lack of knowledge on how to respond. Great. Well, I will tell you, full disclosure, when I had this task of, okay, Head Start is going to really dive into addressing the opioid crisis, I was kind of going into that work kicking and screaming, like, what, like, how are we going to do this in early Head Start and Head Start? Like, we deal with babies and children and, I don't know about addiction. That's not my area of expertise. Like, Head Start has a lot going on. Like, I'm not sure we can do this. And I really, like I said, went into it kicking and screaming. I have come around to completely the other side, thinking that Head Start and early Head Start in particular, and really all of early childcare and education is really the exact place that we should be thinking about substance use and parental addiction, and not only parental addiction, but addiction in general. And that it is just ripe for us to be thinking about this work in these settings. And so I hope to share with you some of what we learned and some of the work that we've done, and inspire you to think about connecting the substance use treatment world with the early education world. So why don't we move forward just a bit? So this slide really looks at, I think, something probably you all are aware of, that in the last year or so during the pandemic, there have been significant increases of overdose related to addiction. Prior to the pandemic, we were actually seeing, increases at that point as well. And because this is a really short presentation, I didn't put in slides that we do have. So if you're interested, we can share them with you and share where they came from. But I do want to acknowledge that while there are significant increases in overdoses in the last number of years, and particularly in the last year related to the pandemic, they are not equal. So there are significant disparities related to these overdoses. We see higher rates compared to the population in the Black population. So the Black population is 12%, and we see 16% of annual overdoses and death. So there was an increase of 18% increase in the Black population related to overdose, increase 17% in the Hispanic population, an increase in 11% in the Asian population. And so there are significant disparities that I want to acknowledge when we talk about this work. And I want to acknowledge that that is related to a history of systemic racism and stigma that's attached, and unequal access to high quality services and all that goes along with that. But again, because it's a short presentation, I don't have those slides here, but if you're interested in them, I'm happy to share. And so why don't we go to the next slide? So when we talk about those high rates of overdose and the high increasing rates of substance use during the pandemic, and again, even before that with the opioid crisis, people weren't talking about what about the children, right? People were focused on the adult in the situation. But for instance, when first responders were going into homes where a parent had overdosed and there would be young children there, we weren't connecting those systems. What about all the children that are impacted in households where there is substance use? And we have this estimate from 2017. I am really curious when we get new data if this might look a little different, but from 2017, one in every 8 children lived with a parent with substance use. And as some of you mentioned in the chat, not every household with a parent with a substance use disorder is going to be neglectful or going to be abusive or going to be involved with the child welfare system. Yet there certainly, due to the nature of addiction, is an increased risk of those things. And there was a time a number of years back when things sort of leveled out in the foster care system. However, related to the opioid crisis, the number of foster care placements rose significantly. And during those years, the last few years, I'm talking right before the pandemic, the population rose in some states by more than 50%. And so 1 in 3 children entered the foster care system in 2017 due to a parental drug use issue. And I will be very curious, and maybe some of you have thoughts about this that you want to share in the chat, but I will be very curious to see what this looks like as we begin to have children come back to in-person services with school, come back to in-person services with early care and education. I think, and from what I've read and my understanding is during the pandemic, we just didn't have ways to see, what kinds of things were going on. And so we have yet to get, sort of what comes out of the pandemic related to this. But we know, and we do have data to know that substance use has increased and overdoses have increased. And so again, I ask all of us to think about what about the children, right? How are the children faring in this situation? So I think we can go to the next slide, Julie. And so when we talk about substance use and substance use disorders, and this is not going to be new information for any of you, but the question often in my mind, and when we discuss this is, why aren't we talking about substance use and substance use disorders like we would any other healthcare issue? Why aren't we talking about it like cancer, diabetes, emphysema? Like if we treated the opioid epidemic or any other addiction like other health services, we would be in a much, much different place. And so the stigma really comes into play with this idea that I'm sharing with you about bringing more awareness and more attention to substance use prevention and substance use support recovery in early care and education. So I want to share with you, we have many, many videos and I'm hoping to share at least one, maybe two with you today of how early care and education can help. And this is a story about a mom who actually participated in Head Start. And I got the incredible fortune of meeting so many families along the way of doing this work. And this is one of the moms who was willing to share her story with us. But even though this is Head Start, and Head Start certainly has many comprehensive services for families, and that it is a 2-generation program, I want to encourage us to think about every early care and education program can do what this program did in terms of the non-judgmental approach with the mom and bringing mom into the fold of learning about early care and education and supporting her with her parenting. So let's take a look.
I live in Eastern Oregon in a town called La Grande. It's in a valley and there's lots of mint fields and wheat fields and cows and it's a very beautiful place to live, but it doesn't always have the resources people need to, get back on their feet or overcome. I'm an addict. When I had my son, he came into this world and I just was not really ready to be a mom yet, just trying to figure out how to get clean, and I got sent to prison. And so he lived with his grandparents pretty much until I got out of prison. I'd never paid bills before, really. I'd worked, but not anywhere for a long period of time, and I'd definitely never been a parent. My boyfriend at the time, he had a daughter who was 4 years old, and she was going to Head Start, and it was her special day, and they asked me to go, and and I was like, well, sure, I guess. I remember being pretty anxious about the whole ordeal because it's a small town. I just figured everyone would know me and know my history, and I was just met with like kindness and love and like no judgment. And so my son Tyler, when he was 3, I was like, he's got to go here. Like there's no other option. We need this. They did home visits and we played games, and I learned how to get a kid to brush their teeth, how to get a kid to try new food, those like fundamental parenting skills. It's hard to put into words like all the little things that have impacted my recovery, but the connections I made with like teachers and staff, it helped my confidence as a parent, and it gave me skills that I just don't think I would have gotten anywhere else.
Well, there's a small group here, so I invite you to come off of mute and share your thoughts or comments or put them in the chat. And I hope that by watching this, you can see that, again, the example is Head Start, and Head Start certainly has comprehensive services as part of it. But this mom talked about feeling not judged, feeling welcomed. She talked about learning from the teachers, tricks that they had and strategies that they used to, help her child get her child's teeth brushed and, deal with conflicts. And the research shows that that happens in any early care and education program when parents and teachers have that close relationship, that parents then look to those caregivers because the caregivers have years of experience with with young children. And parents can certainly benefit from learning some of those strategies and approaches when they have strong relationships with their caregivers. But I invite anybody to have some thoughts or comments on this video. So I'm going to tell you a little bit about what we did in Head Start. So this was a couple years ago, right before the pandemic. We had extra funding to conduct substance use training. It was focused on the opioid crisis. However, they were trainings that took place in each region. So Head Start is broken up into different regions around the country. And so each region had their own event, their own big conference or big meeting. And each event was individualized for that region. So if that region, for instance, was more concerned about meth, or if that region was more concerned about alcohol, we focused each event was individual to their local region. And we had planned to have an event or a big conference. These conferences were about 300 to 400 people, some smaller, in every region. However, the pandemic happened and we didn't get to finish rolling it out in every region. So about 3 regions in the country didn't get this conference or this experience. But why don't we go to the next slide and I'll tell you a little bit more about the objectives for these meetings. The objectives really were to begin to help Head Start and Early Head Start feel more comfortable, frankly, with addressing substance use, feel more comfortable talking about substance use with their families, really working on destigmatizing substance use, really elevating what are those practices that make a difference for families, helping Head Start to connect with their community and their services in their community, and particularly connect substance use treatment services with early care and education and Head Start. And you wouldn't believe how many services out there did not know about Early Head Start and Head Start. So for instance, in the, many of the communities, the neonatologists or the hospitals who were serving babies who'd been exposed to opioids didn't know that Early Head Start existed and didn't know what kinds of services Early Head Start provided for the family and for the children. And so much of what we were trying to do with these conferences is connect those community providers and those services so that they could learn more about each other. And so every meeting that we had around the country, each state got to invite 10 people from their community or from their state, who were in primary care, who worked at hospitals, who were in childcare, who worked in oral health services, all kinds of people, to bring them together, child welfare, for instance, to really understand how we could form these partnerships to address substance use, and those partnerships to include early Head Start and Head Start. And so by the end of the school year 2020, we had over 2,000 early Head Start and Head Start people participate. What they said they got after participating in these 2-day conferences was an increase in knowledge around addiction, and more partnerships or ideas about partnerships that they could make. And each state, run by a Head Start collaboration director in that state, had a team, as I mentioned, those folks from primary care, childcare, all kinds of different folks. And that team in every state formed an action plan as to how they would include, again, Head Start in their work around substance use. A lot of those teams included law enforcement. So we had many police officers there, we had judges, we had all kinds of folks who, again, surprisingly didn't know necessarily about Head Start and early Head Start. And, on the flip side, Head Start didn't know necessarily where the treatment programs were in their facility, or they didn't know, how to connect folks in those ways. And so it was, each Head Start program actually made a plan. So we had a state plan, and then we had every Head Start program that was there making their own plan as to what they would do to increase and enhance their services in this area. We can go to the next. And so every conference we had a number of workshops, probably about 6 to 7 workshops over a couple days, and folks could choose which workshops to attend. Every conference had a workshop on addressing disparity, equity, and access. And that was very purposefully put in because we wanted to acknowledge that during the opioid crisis, things were handled very differently than they were, for instance, during the crack epidemic, when substance use was highly criminalized at that time. And now with the opioid crisis, people are really beginning to see more of addiction as a disease, and thinking about things like having early childhood help in the addiction world. And so we made sure to really put that front and center in the work that we were doing to acknowledge those disparities. We offered a Train the Trainer series so that anyone who attended the workshop could attend this Train the Trainer and then take away those tools so that they could go back to their program and train in their program. And these are just other examples of sessions that we had. As I mentioned, each Head Start program and each state team came out with some action plans. And these are the types of themes that they had in their action plans. Many said they would go back and train their own staff, or they would engage in more partnerships in their community. We focused highly on the language and destigmatizing. And so they said they would work on their policies and work on their services in terms of the language that they use. Various types of goals here related to their action plans. I think we have time. What do you think, Julia? We show this. I think we have time. Yeah. I'm going to show you one more video, and if you like these videos, we have a ton of them. We have them related to grandparents caring for grandkids. We have many animation stories with families. This is a sort of a general documentary style video. So these are all available on the ECLKC, which is the Head Start One Shop Stop.
Opioid epidemic is taking a heavy toll on women.
Parents are addicted, locked up, or going into treatment.
What happens to their children?
I'm Ariel. I go by Ari, and I'm a drug addict in recovery and mom. Like, I could love my children more than anything in this world, but when I'm using drugs and alcohol, that doesn't matter anymore. All I remember is them being like, we can't leave your child with you like this.
We're seeing a lot more children removed from the home. We're seeing children that are raised by grandparents or aunts or uncles.
I think we have realized that this is an issue that no individual agency can deal with alone.
We work with outside mental health agencies. We refer to neurologists, psychiatrists, developmental pediatricians.
We're referring them. We're also making sure it's kind of like a warm handoff. So
there's numerous organizations that come together, and we all pretty much have the same mission statement of keeping children safe, making families stronger, and putting them in a community that's highly functioning.
So that trauma-informed care is really the basis of what we do.
So that collaboration is absolutely essential in providing the best services possible for the community.
We've seen many examples of individuals that are part of the Head Start family, our Head Start family, that have struggled, have gone through lots of ups and downs, but they make it. And many times it's because of how much they care for their children. They want to be the parent that they used to be.
And for them to be like, okay, we see it, you're doing what you need to be doing, like, we're gonna give you back your child. Like, that's huge. I can only imagine the pain that I've put people through, but God, am I happy that Head Start stuck by me. Because if they didn't, I wouldn't be here.
He just wants his mama. He just wants his mama.
One of my favorite Mr. Rogers quotes is, always look for the helpers. And, you know, we have a great team of helpers in our community that are working with our children and families who are in these difficult situations. So there's always hope.
I welcome you to share some of your thoughts and comments in the chat. And again, if you like these videos, or if you think part of these videos would be interesting, you know, we have many variations on these to share in the ECLKC. I think we have a slide here that focuses on the ECLKC. Well, so I'll go to there in a second, but I would, yeah, go ahead, Julia. Sorry. I'm going to share with you some of the resources that we learned about along the way. So every region, like I said, was unique in terms of bringing in experts from that region. And so we got to learn about all kinds of cool resources and services that we didn't know about. And this was one of my favorite new resources. It's called a dictionary. And you can, go on and see every term related to substance use and whether or not that term is stigmatizing or contributes to a stigmatizing approach. And so it'll give you a little stigma alert if that term is contributing to stigma, and it'll explain to you why and what language would be a better word to substitute. So if you haven't seen this, I highly recommend checking it out, a dictionary. Thanks, Julia. And then here's the slide that lists a few things that we have on the Head Start website, the ECLKC. We have many family stories, as I mentioned. We have many of those documentary style videos that focus on different areas. We have that train the trainer that I mentioned earlier. So there's a training PowerPoints, notes, a facilitator's guide that anybody can go and download and use in their programs. We have something called My Peers, which is like a Facebook page that has resources and people can chat with each other and ask each other questions in this area. And we can go to the next slide. And then this was an organization that I learned about in one of the regions. Someone identified the person who started this organization, and he ended up being one of our plenary speakers. And as I learned and started talking to people, when you provide that open space and that non-judgmental approach, people share with you their incredible stories. And so this man developed this organization to create podcasts after his son had overdosed. And he now has over 284 podcasts with some of the top researchers, journalists, therapists, I mean, the best folks out there who are doing this work in addiction. And you can hear all these amazing podcasts that he developed in terms of his organization. So if you haven't heard of Cover 2, check it out. Really great podcast and really great resource. We can go to the next one. Another organization that I also learned about along the way as we, engaged in this journey is an organization called Shatterproof, and their area of focus around addiction. It's also an organization that was started by a father whose son also unfortunately overdosed. And he was just amazed at how hard it was to find information out there. And so he also developed an organization to reduce stigma and to get information and training out there around addiction. So I encourage you to check out the Shatterproof resources. We've begun to incorporate their work around stigma reduction in Head Start. And I think we might have one last slide to leave with you, to hope that you would engage in a dialogue with us around your thoughts about this work, your thoughts around the videos, does it inspire you to kind of connect and collaborate? And maybe I can share with you, well, I did share with you my experience of going into this work kicking and screaming, and now having it be my favorite work after I learned more about addiction myself and really saw how early care and education can be a really natural place where people feel comfortable. And again, not just thinking about addiction of parents, but also people who are working in our programs. So addiction, I think we all know someone who has experienced addiction, and just how we talk about it, how we normalize it, and how we use those natural resources to make a difference.
Amy, while people are pulling their thoughts together, I just want to say a huge thank you for sharing all these amazing resources and just the scope of work that Head Start did around addiction and the opioid crisis. I know for those of you who were with us during our last session, we talked a lot about how to start conversations around destigmatizing substance use in early education. Thank you so much for being here with us today, and thank you all for logging on. We will be sending out an email shortly that has the PowerPoint as well as a handout attached, so you'll have access to all these resources. Alice put an evaluation in the chat. If you can take just a minute to fill out the evaluation, that would be greatly helpful for us so that we can continue to provide services and know what feels relevant to people, so that we can keep having these great communities of practice. And a huge thank you again to Amy Hunter.
Thank you all. It was a pleasure to be with you. Don't hesitate to reach out if you have more questions or want to access some of the resources.